as highlighted, my name is Mapendo Mindje, and I'm from the University of Rwanda, teaching staff and the former One Health Team Club member, so I'm acting as technical advisor of the club. In this presentation, I'll be highlighting the roadmap of the University of Rwanda One Health Team Club, so that we highlight the role of the One Health workforce, as this platform is helping a lot the club to implementing its activities at daily basis to improve or to change the behavior of the communities around, and also to increase the chances of the community to be free of zoonotic diseases. An introduction: in Rwanda, lots of people live in complete shortage or scarcity of basic needs like safe drinking water, scarcity of access to food, also reduced health care, education, and decent shelter, as it was published by the IFPRC in 2009. However, other communities are living in areas that are in the vicinity of national parks. As you all know, national parks are areas where there is this interface between wildlife, livestock, and human, hence increasing the chances of zoonotic disease transmission. Now, for the One Health Club, as guided by the mission to minimize the risk of zoonotic diseases, the diseases that are existing in parks or existing in animals, the club has the mission to design various activities so that they can enter communities and impact changes. To enter communities and try to change the way they are using different factors like ecosystems, so that they cannot really get in touch with animals and get these zoonotic diseases. This is a brief description of the club, which I have been also part. It's for the University of Rwanda. These are the members. And as Rwanda today has only one public university, University of Rwanda, it has established a number of colleges. And of course, each college will be having different schools under which departments are operating. And all the students have been sensitized to be part of this club so far. Now, why did I think of carrying out this study? What I saw in communities in Rwanda, you're finding people, they are living in ignorance or in complete unawareness about the transmission of diseases. You are walking around and find communities are doing really crazy things, but it's crazy, yes, because we're scientists, but for them, they don't know. So I said, it's our mandate as One Health promoters to impact changes within these communities. That was the aim, the reason why I would like to carry out this study. And the case study was to see now these activities that has been designed by the club, how are they contributing to the communities? Because the club has established an action plan, and among all of those activities, there are of course many of them that are of community importance. Now, I wanted to identify all of these activities and later on come up with the output. I'm happy today we have Dr. Gashumba and the focal person, Dr. Robert Kibuka, who have been all the time with us. When we want to implement these activities, they always help us to reach the local authorities so that we can have permissions and enter communities to impact changes. Of course, I had to gather all the time we carry out any activity. There are some evaluation forms we have to distribute to different communities, and then we assess to see whether what we have told them, at least they have stayed with a kind of education. Now, as the result, the club has implemented so far lots of activities, including rabies campaign awareness. It has done malnutrition, sanitation, and hygiene campaign. It has entered those communities which are living nearby national parks and tried to tell them about zoonotic diseases. It has also underwent a radio talk show. In addition to all of these activities, the club also has tried to raise awareness about different other infectious diseases that can raise due to poor sanitation during refugee camps. Now, for this activity, this was implemented some 2 years back as the club was established in 2013. It's rabies campaign. When we were doing this activity, the evaluation showed that the communities were not aware about the transmission of rabies. They thought that rabies is like any other disease that can be treated, and we told them that the case fatality rate is 100%. And up to now, they didn't even know that the bats can also be part of rabies transmission. So you understand that we could just go in communities and teach them how a disease can be transmitted, because if you know how a disease is transmitted, obviously you know how to prevent it. So the community was living in complete unawareness about rabies, and because of the club activities, at least we are contributing something to the country. Next activity was implemented in 2 refugee camps, one located in the eastern Rwanda, where some Rwandese were brought from Tanzania and were located somewhere in some sectors in the eastern part of Rwanda, eastern province. And another activity, similar activity, was as well conducted in another refugee camp that is located in the western part of Rwanda. This is in the Kiziba district. So the aim of this activity was to teach the communities, these ones were target groups, the communities that are living in such conditions. You all know that living in a refugee, I don't know how many have been in a refugee camp, but at least you have some data showing that people who are living in areas like camps, refugee camps, really there is obvious reduction of high sanitation, high hygiene. Obviously also malnutrition is a problem here. Now, what is to be done is by the health club. We enter communities, these refugee camps, we teach them the problems that can arise from simple ignorance. Like, for example, they never knew that vectors like the flies, the domestic flies, can bring worms into their household. So, however, we taught them that having sanitation, hygiene, cleaning household, where you sleep, your clothes can also help in improving your livelihood. Another activities was during the demonstration site that was carried out by the club, lodging in the Akagera National Park, but carried out in different sectors that are living around the national park. The first picture here, you can see we visited the slaughter slab. Amazingly, if you well see the picture, the person who is slaughtering the cattle, he has bare feet, okay? And I'm sure these feet were very dirty, and they are slaughtering on a very bare ground. They just cleaned it, and they were slaughtering the meat to be brought to the butcher. Can you imagine how many diseases can arise from there, from this simple transmission? Another activity that carried out was the rice scheme, the rice seed plantation. I'm happy to present this because I myself carried out a research on schistosomiasis, where I found rice scheme are creating favorable environment for snails. These are mollusks, and they harbor intermediately schistosoma parasite. Now, these people here, they were cultivating with bare feet, so there is a high chance, so this is a risk, there's a high chance of schistosoma to be transmitted to them as well. The last activity that is shown, this is a milk collection center, where this is located in the eastern part of Rwanda in Kanza district. It was amazing to see the receptionist received all these members of the club with the dust, with what inside, without even giving them any PPE. This is part of the equipment, and there was, of course, no excuse. And actually, he should have said, please don't enter. But we don't blame them because they live in complete unawareness. So the club just came in and also addressed the public health issues that can arise and the behaviors that are ongoing. Radio talk show is also another part of activity we carry out where we transmit the One Health message to a broader community. And the assessment shows that how did we know that this has been effective were due to the calls that we received afterward. Because you know when you're doing a radio talk show, you have to receive calls from the community asking lots of questions. And since time was limited, we couldn't answer all the questions. And in our future plans, we're planning also to go back and talk about other issues. Now, in conclusion, really the One Health workforce is playing a very important role in supporting the club with the USAID funds, which we are really cordially acknowledging. So there is need for this club to be strengthened at capacity level, as one of the colleagues have been talking about. We need the club also to be exposed to maybe other countries. Thanks to God, we are now today in Uganda, and last week in Addis Ababa. We wish we also go around to try at least to see how other people are doing so that we can implement back home. A recommendation is to extend, this club has been operating in the University of Rwanda. We also recommend the club to operate in the private other universities and create the club also in secondary schools because youngsters have been seen to induce long-term change. Murakoze cyane.